So happy to be back from Los Angeles. I would love to talk to you about something really fascinating that I saw at the meeting discussed, and that has to do with PLLA, the chemical abbreviation for Sculptra. PLLA has gotten a lot of bad rap these days, and the meeting covered why in facelift surgery that's the case. Basically, PLLA creates volume by generating collagen around these particles that are injected. The problem is that the collagen is laid down as if the PLLA is a foreign body reaction, and it can become excessive if a lot of collagen is laid down in a small space. So this is an inflammatory reaction to PLLA that the body creates, and therefore, the more of the reaction there is, the greater the amount of collagen that's deposited. Also, the greater the number of molecules that are injected, and the concentration of that injection has to do with how this reaction occurs. So PLLA is a fabulous product for patients with severe volume deficits, but it's more of a shotgun approach to volume. It creates volume, but not targeted volume very well. In fact, if you try to put a lot of PLLA into a small area, you can get nodules that are quite firm and don't move well with the body. And so to avoid that, the injector will diffuse it through tissue, but diffuse volume doesn't create targeted volume. So you'll see a lot of pictures online about PLLA creating all these granulomas, granulation tissue. It looks awful when a surgeon takes pictures of it, but in fact, it's what the body's doing that creates the volume. So it's actually a normal response to PLLA. It's not abnormal, and it's fine, except that if you're the surgeon, you have to get through this thicker collagen stuff than tissue that doesn't have that stuff in it. So this might create some concerns by surgeons that are that aren't used to dealing in this area as much. But for an experienced facelift surgeon, for example, it's not really a big deal. You get through it. The patient may have a little bit more swelling post-op because of that additional dissection that's required, and it might take a little longer to get through it safely. But as long as the patient understands what the issues are and the surgeon understands how the technique has to be modified to account for the PLLA, there really is not a big problem, in my opinion. Now, other surgeons will differ. Other surgeons think it is a big problem. Well, I don't know. I've been around 30 years. This is a little problem. The big problems would be causing some real issue with the tissue with permanent filler, like silicone when it was injected. Or today there are permanent fillers being injected, which makes no sense to me. I mean, the permanent fillers create collagen responses in the same way as PLLA, but it's permanent. And if it's not right, you can't get it out. PLLA at least dissolves gradually over the years, and although it creates long-lasting outcomes, 2-3 years worth of outcomes, if it's incorrect, it can be either removed or the collagen response suppressed with things like steroids. So my opinion about Sculptra, it's a nice product. It's good for injecting mid-phase to create some buoyancy. It's good for creating diffuse, filling the temples. Great for patients that have real atrophy, but not so wonderful for targeted volume. If you want a jawline enhancement, for example, PLLA is probably not the right thing. There are other fillers that work better and last nearly as long, if not quite as long, just still much better in the long run. And fat works great. I mean, fat transfer, it's more of a surgical procedure, but man, that works just wonderfully. So that's my thought on PLLA, this backyard discussion today, Monday, the first day of fall, 2025. Happy fall, everyone.